There is a case of thinned out parenchyma due to severely obstructed stone with gross hydroerythronephrosis. Some of the complications, some of the techniques we are showing. Actually, 58 years old male patient. Whenever PUJ stone causes severe hydronephrosis leading to poor functioning kidney, it will be usually difficult case. See the anteriorly located stone, very anterior. This reconstruction you may not understand, only except it's a kink. As expected, from below we could not pass guide wire, we could not pass ureteric catheter, we could not pass contrast, ultrasound guided clue has taken. Anywhere if you puncture, urine will come. We tried to be posterior so that we can reach anterior. Contrast injection, dilute and passing a guide wire multiple times is done. Dilatation is done. While amplatz is withdrawn, care taken that it is kept at the PUJ that so that you will not come out of the kidney. Entire surgery we have taken not to come out of the kidney. We have not used laser, should not be used. These impacted stones will have gum-like structure which causes adhesion to the wall of the pelvis. Never try to pluck out large stone. Make it pieces as much as possible. See, this is the gum which so you have to rotate and take it out. This is again gum, rotate and take it out. Don't be too much aggressive with large forceps and try to be slow. Take time till you reach the guide wire from below person. Otherwise you will be losing the tract. Now slowly mucosal lined tract is there. All the stones are there. Keeping the amplatz at the mouth is very difficult. Senior technician or urologist should be there. Once all these stones are removed, ureteric catheter is seen. You pass the guide wire. The good thing I have done is I passed the guide wire from below and taken out from the tract. Then the mistake I did is I went to the upper pole to see any stone migration or any other stone. There was only few pus attached to first plaque attached to the papilla. At this juncture, I missed the amplatz sheath out of the kidney. I missed the amplatz. Entire procedure I was taking care. Now I am helpless, but my guide wire helped a lot. Even then, the problem is not over. I thought I will use the Alken rod up to the PUJ and dilate and go see, but unfortunately after dilatation I am still in the outside. That creates little bit of discomfort. Fortunately this is done after the stone removal. Even stenting can get out of the job, but this is not a willing desire because urine can leak from the kidney. Unnecessarily perinephric hematoma can occur. I used small mini perc sheath, that also did not go. Now what will you do? Better to keep nephrostomy. How to keep nephrostomy? We don't know where you are in the perinephric region. So I passed a Cobra catheter. This is smooth from the Cook, whichever company. Over the guide wire through and through is present luckily. Then I told the person to see from below. I have passed into the ureter. Then only I am 100% sure that I am not damaging the PUJ. Then ureteroscopy is done. While doing ureteroscopy, small flakes were there in the ureter. You have to be very careful. In ECIRS or supine PCNL position, this is the major advantage. You go through the ureteroscope with the guide wire, remove all the small pieces, make space for yourself, go into the ureter. Now this is the Cobra catheter. Cobra catheter is seen, then I am confident, then only I have dilated the entire pelviureteric junction slowly, so that ultimately to put the nephrostomy I have to be safely in mucosal lined cavity. So I have taken double care so that small nephroscope has gone into the pelvis. I am back to the kidney mucosa, and then I put nephrostomy without wasting time, and nephrostogram showed a very clearly dilated system of the pelvis. After that stenting is done from below, and post-operative 2 we want to confirm the nephrostomy is way below the kidney, going close to the pelviureteric junction. You can appreciate here it is very close. However, it was in the system. It has not gone through the colon. So because it is posterior, So the message we want to give is, whenever there is a large hydronephrotic kidney with impacted stone, once you ensure that amplatz sheath doesn't come out after collapsing of the kidney, pass a guide wire as soon as you get from below, and never take things granted till the end. The amplatz sheath will be very much inside, only a few centimeters amplatz will be outside. So assistant should be in very much care not to take out the amplatz sheath 1 centimeter also. In desperate situations, the cobra catheter with the guide wire helped to put the nephrostomy, and patient did post-operatively well. Thank you.